Paramedics are often the first responders to scenes of traumatic injuries where quick and effective intervention can mean the difference between life and death. Trauma encompasses a wide range of injuries caused by external forces, including lacerations, avulsions, puncture wounds, amputations, and blunt force trauma. We will explore the types of injuries paramedics frequently encounter and outline the key steps in the assessment and treatment of trauma patients. Types of traumatic injuries. 1. Lacerations. Lacerations are deep cuts or tears in the skin and underlying tissue, often caused by sharp objects like glass or metal. These injuries can lead to significant bleeding, especially if major blood vessels are involved. Assessment. 1. Assess the location, depth, and extent of the wound. 2. Evaluate for arterial bleeding, spurting blood, or venous bleeding, steady flow. 3. Check for signs of hypovolemic shock, such as pale skin, rapid pulse, or low blood pressure. Treatment. 1. Apply direct pressure to control bleeding. 2. Use sterile dressings and bandages to cover the wound. 3. If necessary, apply a tourniquet proximal to the injury to control life-threatening hemorrhage. 4. Monitor for signs of infection or other complications during transport. 2. Avulsions occur when a section of skin or tissue is forcibly torn away, sometimes leaving it partially attached. These injuries are often the result of machinery accidents or animal bites. Assessment. 1. Determine the extent of tissue damage and assess for contamination. 2. Check for associated injuries, such as fractures or nerve damage. Treatment. 1. Control bleeding with direct pressure and sterile dressings. 2. Preserve any avulsed tissue in a sterile, moist environment, such as saline-soaked gauze, and transport it with the patient. 3. Elevate the injured area to reduce swelling if appropriate. 3. Puncture wounds, example knife or gunshot wounds. Puncture wounds are deep, narrow injuries caused by sharp or pointed objects. Gunshot wounds can cause extensive internal damage, even if the external wound appears small. Assessment. 1. Identify the entry and exit wounds, if present, and assess the trajectory. 2. Look for signs of internal bleeding, such as abdominal distension, hemoptysis, coughing up blood, or decreased breath sounds. 3. Consider the possibility of organ damage or pneumothorax, collapsed lung. Treatment. 1. Control external bleeding with direct pressure. 2. For chest wounds, apply an occlusive dressing to prevent air entry and potential tension pneumothorax. 3. Monitor vital signs and provide oxygen as needed. 4. Prioritize rapid transport to a trauma center for surgical intervention. 4. Amputations. Amputations involve the complete or partial severing of a body part, often resulting from industrial accidents or severe trauma. Assessment. 1. Evaluate the level and completeness of the amputation. 2. Assess for signs of hemorrhagic shock. Treatment. 1. Apply a tourniquet above the site of amputation to control bleeding. 2. Wrap the amputated part in sterile gauze. Place it in a plastic bag and keep it cool but not in direct contact with ice. 3. Provide pain management and emotional support to the patient. 5. Blunt force trauma. Blunt force trauma results from impact injuries, such as those sustained in motor vehicle collisions or falls. These injuries can cause internal damage, including organ lacerations, fractures, and internal bleeding. Assessment. 1. Perform a primary survey to identify life-threatening injuries. 2. Look for signs of internal bleeding, such as bruising, rigidity, or distended abdomen. 3. Assess for fractures, especially in critical areas like the pelvis or femur. Treatment. 1. Immobilize suspected fractures with splints or backboards. 2. Provide oxygen and monitor for signs of shock. 3. Initiate intravenous fluid resuscitation if indicated. 4. Rapidly transport the patient to a trauma center for further evaluation and treatment. Trauma patient assessment and management. Effective trauma management begins with a systematic approach. 1. Scene safety and initial assessment. Ensure the scene is safe for responders and the patient. Perform a primary survey using the ABCDE approach. Airway. Ensure the airway is open and clear. Breathing. Assess respiratory rate, effort, and adequacy. Circulation. Check for major bleeding and assess pulse. Disability. Evaluate the patient's neurological status. Exposure. Expose the patient to identify hidden injuries while preventing hypothermia. 2. Secondary assessment. Conduct a head-to-toe examination to identify all injuries. Obtain a sample history, signs, symptoms, allergies, medications, past medical history, last oral intake, events leading to injury. 3. Treatment and transport. Prioritize life-threatening injuries and initiate treatment en route. Communicate with the receiving facility to provide a detailed report. Conclusion: paramedics play a critical role in the pre-hospital management of traumatic injuries. By understanding the types of injuries they may encounter and employing a systematic approach to assessment and treatment, paramedics can stabilize patients and improve outcomes. Ongoing training and preparation are essential for handling the complexities of trauma care in the field.